Children have constipation if they have pain or straining with the passage of firm or hard stools. Often the bowel movements are a bit infrequent and they might occur less than 3 times per week. If the child's having these symptoms for more than 3 months, then we define the constipation as being chronic. Constipation can develop over time, and very often it begins when a child experiences a painful bowel movement and then starts to hold back bowel movements. This leads to more stool being accumulated in the colon, and the longer the stool stays in the colon, the harder and larger it gets. For parents to know whether their child may be having constipation, we recommend that they watch out for some clues. For example, is their child passing lumpy, hard, or pellet-like stools? Or is the child straining or complaining of pain with bowel movements, or avoiding or refusing to use the toilet? Is the child complaining of abdominal bloating, feeling full, or just not eating as much as they used to? And are the parents noticing soiling in the child's underwear or an increase in bedwetting? To prevent constipation, parents should ensure that their child drinks plenty of fluids during the day, especially water, eats a diet that's rich in fiber, including fresh fruits and vegetables, and avoids processed foods and foods high in fat and sugar. It's also really important to encourage your child to be physically active, because physical activity helps our GI tract regulate our bowel movements better. And the child should also understand to never hold or ignore the urge to move his or her bowels. Now, for toddlers, parents should make sure that when the child is on the toilet seat, that their legs should be propped on a stool or box for support with their knees at right angle, because this position actually helps the child pass a bowel movement more easily. Now, in our pediatric gastroenterology clinics, we see hundreds of children each year with chronic constipation, and we now know that many children with these severe symptoms can benefit from a team approach that includes educating the family about constipation, using the medicines daily and at the right doses, and teaching the family behavioral techniques that are going to minimize the discomfort the child feels about toileting. And we've actually started a new constipation clinic at the Johns Hopkins Children's Center that will provide not only medical management of the child, but also provide evaluation and treatment by a behavioral psychologist.